Hi everyone, welcome to this new episode Common Sense Aligners podcast. Today we are going to start a new block of contents. If you remember, the first block of contents was based on ethical approach to aligner orthodontics. In the second block of contents, we talked about technology and how can we integrate this into our offices to make our treatments more efficient and achieve better results. And today we're going to talk about a different topic. It's about communication with the patients. We all know every day we communicate with the patient. It doesn't matter if it's a first consultation, an initial consultation, if it's a regular checkup, or maybe it's a checkup for retention after the patient has finished the treatment. The thing is that this is really important, and sometimes we do not pay enough attention to communication. So in the next block of content, we're going to talk about communication based on four main topics. Communication related to compliance. Can we communicate more, or can we communicate better to increase the compliance of our patients with clear aligners? This topic has been really important for orthodontics for the last 50 or 60 years. It doesn't matter if it's fixed appliances or clear aligners, we need the patient to be compliant. So communication and compliance is a really strong point in this block of contents, and this is why this is the one we're going to cover today. We will also talk about the communication related to the treatment itself. How should we address the concerns of the patients around the treatment? We're going to talk about the financial arrangements in this third block of contents. In this, we will try to figure out which is the best approach to face this with the patient, to start talking about financial arrangements, to avoid having problems in the future. And in this block of contents, the fourth one will be around, we all know communication is important, but apart from this, we need some keys. And having keys is vital. And I think, from my point of view, sometimes just having 3 or 4 sentences or even verbs that we can use in our conversation with the patients, it's pretty useful and will help us solving most of the situations in an easy way. So let's start with the topic today: communication and patient compliance. So if we are talking about patient compliance, we have to understand that it is really important that the patient is compliant with the treatment. It was important with fixed appliances, and it is even more important today with clear aligners, since they are removable. The patient can decide if they're wearing the aligners or not. And this is making a big change. I mean, if the patient is compliant and the treatment is properly set, we will success. But if our treatment is perfectly staged and sequenced and everything, and the patient is not compliant, we're not going to get a good result. We're going to have problems. And this is why it's really important to make the patient aware of this, of the compliance, and think of the key points we can change in our daily practices to improve patient compliance, to increase it, okay? And there's another part really important for me. I mean, we can talk about the success of the treatment, but the path, the way we're having until we finish the treatment is changing with patient compliance. When a patient is compliant and is using the clear aligners, we're going to have an easy way to that ending point, to that retention point. But when the patient is not compliant, when they're not wearing the aligners enough, or they forget the aligners, or maybe they lose them, it's going to be more complex. It's going to be more tough. We're going to dedicate more time. We all know these typical cases we have in our offices. Years and years with additional aligners, scanning the patient one and again because they're not compliant with the treatment. So this is vital because this is making our practice less efficient and it's putting more work overload in our staff and in ourselves, in the doctors. So we have to be really aware on the fact that compliance is vital for the success on the treatment and for the treatment itself to be good, to be easy for both parts, the patient and ourselves. If we analyze which factors influence patient compliance, and we get back to the literature, you can think of the severity of the crowding, of the malocclusion, it's affecting the patient. Okay, so if a patient is having a severe malocclusion and they are concerned and they know they have this anterior crossbite, for example, if it's a class 3 and they know they don't bite properly, they will be more compliant. Statistically, they're more compliant than patients thinking, oh, my correction is just a minor correction, it's maybe aesthetic. So the patient having a bigger problem usually is more compliant than the patient with a less concern. The thing is that many times the patients will think they just have a minor aesthetic issue, but if they have a bigger problem, we have to talk to them. And this is why communicating is so important for this. Obviously, depending on the country, of the city of residence, even on socioeconomical status of the patient, there are going to be a few differences, but this is usually something we cannot decide. I cannot decide which city do my patients come from. Usually it's around me, so I cannot change this. And this is the point. If I cannot change the origin of the patient, if I cannot change the status, maybe I can change the communication in my office, but it's a bit more complex. The only thing I can do is to improve the communication and make the patient aware of the problem they're having. Because in this way, if they're more aware of this problem, they will be more prone to wear the aligners and adapt the treatment properly. Also, for this, it is important to stress that I don't think we have compliant or not compliant people. I mean, it's like going to the gym or any habit we might have in our daily lives. If a person is like not really consistent going to the gym, maybe they are consistent meeting their friends or playing the guitar. It's a matter of behavior. So this is something we can change. We cannot qualify a patient as a non-compliant. If they are non-compliant for some reason, we have to understand that this is a behavior, and behavior changes from time to time. It's different. If we give this person the proper view, the proper angle to view the problem, which is usually the malocclusion. So please remember that we can change our patient's behavior if we communicate better with them, and this is going to improve the compliance and the aligner wear or the intermaxillary elastics or whatever they're going to have in the future. Just by communicating better, we can improve their awareness and by this also improve their compliance. So we were talking about this communication of compliance. What can we do to improve compliance directly, like in a really, really specific way? Because we're talking about improving communication. As I said before, in the following episodes, we will give you some hints on which are some keywords we can use with the patients. But it's also useful to improve the communication, and we will talk about this. Usually patients, they are stressed. They're suffering from some anxiety when they are in our offices, and they are nervous. And we start talking about like so many complex things, class 2 or class 3 or tooth extraction, and the patient is thinking of the payment and on the length of the treatment and on the social impact they might have with the clear aligners or fixed appliances, and they are really, really anxious about this. So their mind is not processing the information properly. Probably you're listening to me relaxed and calm in your car or in your house. But imagine you're really nervous about something. Probably at the end of this podcast, you will be not sure of what I said. And this is why it is really important to create an environment in which the patient can listen to us. But if this is not possible in 100% of the visits, what we have to do is reinforce this communication. So it is important that we provide the patient with some visual documentation, okay? So maybe we're talking with the patient, we're explaining everything, and we can hand them some printouts of the information we're giving so they read it when they get at home. Or maybe we can give them private access to our website in which they have some information related to the procedures they are going to have. Also, and this is something I like a lot, especially now that we have our smartphones, what we can do is just record a video, filming the screen with our smartphone, and send this video to the patient. This is something quite easy. It might require just 2 to 3 minutes per video. Usually the videos are mostly standard, and it is better if we adapt it to the patient. If we mention the patient, it's like, this is a video for Javier. I'm going to pay more attention to that. And this is what is creating rapport with the patient, and this is creating a way to communicate with them more effectively. Remember, I insist, and I'm going to be really intense about this, communicating better is not just because we want them to be happier, but we also will be happier with the patient on board, with the patient using the aligners as much as we need. Also, there are some other ways to improve the communication with the patient, especially if we want to let them know if they are toothbrushing properly or if they are wearing the aligners enough. How can we do this? We have these artificial intelligence apps like dental monitoring. They take the pictures in their house, they upload it into the dental monitoring app, and they check what's the evolution. And we can communicate with the patient effectively without the patient having to be in the office. This is creating a good environment. The patient is relaxed, is taking a picture at home, okay? They're uploading it on the platform, and maybe on that same day or a couple of days later, we will give them some feedback. This is quite important because if the feedback we're giving to the patient is like, good job, you're working good, they will be happier and they will be more prone to continue with the treatment. If we tell them, sorry, John, you're not wearing the aligners enough, I can see some misfitting, they're going to understand that they have to do something extra. They have to do something additional to what they were doing before. And this is something really important too. If we're talking about compliance, as with any other behavior, obviously we are going to highlight those patients not wearing the aligners or the elastics enough. We're going to tell them, okay, so you're not wearing the elastics enough. But in the opposite, when the patient is using the elastics as much as we require, we have to thank to them. We have to elevate them somehow. We have to tell them, okay, good job. I'm really happy you're doing this because we're going to end up the treatment in time and with an excellent result thanks to your cooperation and your collaboration. I know this is something every patient should do, but we know this doesn't happen. And okay, with this praise we're giving to them, we are encouraging them to continue doing that. Sometimes we see this in our patients. They start really happy and really excited, and they lose the interest in treatment, and they reduce their compliance. And this is something we can encourage just by praising them when they do the correct thing, the thing we are expecting from them. So it is not just about, for example, setting penalties. I think it's a good approach to set some penalties, maybe financial penalty. If you're not compliant, this is what we call mid-course correction. Okay, so I suggest that you tell the patient, okay, I expect you to be compliant and use the aligners 22 hours per day. If there is a problem during the treatment, you have to understand that because of the lack of compliance, if we have to plan a new set of aligners and we have to work on your treatment plan and we have to bond new attachments, you're going to need a mid-course correction with a cost of, I don't know, 500 euros. It depends on the market you're seeing this podcast from, or you're listening us from, but it is important to set these kind of penalties. Of course, the most important thing is to praise the patient when they're doing good, encourage them to continue doing that. But, and this is important that we do it from the very beginning, we have to set the penalties they might have if they're not working properly. Not because we want to make extra money with this, but because we want them to understand that this is creating a problem for the treatment, for our team, for ourselves, and they have to think of this. And if we talk about these penalties, there is, I would say, one exception to this. Okay, in most of the cases, in my practice or in my previous experience, I can tell that kids are more compliant than adults. So whenever I have this mom in my office asking me, okay, doctor, do you think my daughter, she will be wearing the aligners enough? I usually tell the mother, okay, they're usually more compliant than you are with your aligners. We adults tend to forget about the aligners, but kids, they're really compliant. But in some cases, we have to face the fact that any patient, it doesn't matter if it's an adult or a kid, they can forget about the use of aligners. In this case, having the penalty is not a good idea. And why is this? Because the penalty is not going for the kid, but for the parents. A longer treatment in a teenager means the parents of this teenager will have to come to our office more times to dedicate more time to the treatment itself. So if we're setting an economic penalty for this, we're not facing the problem, because the problem is that the kid is not wearing the aligners enough. If we're setting this mid-course correction for the teenager, is the parent paying for this. And usually the parents, they really want their kids to use the aligners and wear the aligners enough. So we have to address it in a different way. In these cases, I know it is complex. It is complex because we're trying to change behavior with a small interaction with the patient. Maybe the patient is, 13 years old, and they arrive to our office, and we spend with them 20 minutes in that checkup. We cannot change the behavior of a patient just in 20 minutes. We cannot encourage them enough to wear the aligners, and we cannot set a penalty for a teenager because they're not going to be responsible for the payment. So it doesn't make much sense. It is not going to make them a better user of the aligners. So in this case, we have to reinforce the communication. I know most of us, we are focused on communication with adults, and we usually give really technical and really concise information, like the information you see on our social media at Common Sense Aligners, okay? You see these techniques and these aspects, and we are really concise. But with kids, it has to be different. We have to consider this as a game, probably changing the style of the communication, introducing some cartoons, or changing the language, or using these web-based artificial intelligence apps. This is increasing the chances that the patients are wearing the aligners enough. So, to summarize what we've been talking today, we have to understand the effect of patient compliance in the treatment length. Okay, this is quite important because this is leading us to success, and it is creating short treatments, not short, but with a reasonable length. We have to face the reality that the compliance can only be increased with a change in the behavior of the patient, and this change is mostly related to the severe the situation of the malocclusion, and if we don't talk enough with the patient about this, it is going to be complex. So for adults, this is okay. Talking about the complexity of the malocclusion and stressing them the importance of biting properly at the end of the treatment, this will encourage them to use the aligners. With kids, we're going to use a different approach. As we were saying, setting penalties and mid-course correction cost for adults is okay because they're going to be responsible for the treatment and for paying these penalties. But with kids, it's going to be different, and we have to adapt the language we're using to communicate with them, okay? This is quite important, and we have to try to make it as a game. And this is the summary of today, but I want to stress something. This communication issue is something we cannot do on our own. We have to train our team. You have to tell your associates, other doctors in your office, the people at reception desk, hygienists, dental nurses. We have to train them to communicate with passion, to be intense and be interested on this, because this is going to be the main driver. And this is not something we can automatize. We have to train our team and discuss with them what is the best approach. With this in mind, we will for sure be success and increase the patient compliance. But remember, communication is not just about the doctor, but it's including the whole orthodontic team in your dental office. So, thank you for your attention today. Remember to like this podcast if you enjoyed the contents today. Remember to subscribe to our newsletter and follow us on social media, and download all the contents in the Common Sense Aligners program, because you will for sure master communication with patients, but also every single orthodontic treatment with clear aligners, thanks to our step-by-step program.